using qualitative interviews and deliberative dialogue to triangulate systematic review findings about clinicians' use of patient-reported outcome measures in daily practice. This is Dr. Angela Wolf, a professor at the Trinity Western School of Nursing. I'm presenting on behalf of my colleagues as well, Dr. Nellie Olkey, assistant professor at the University of British Columbia, as well as members of my research team at Trinity Western, Dr. Vidhi Thacker, who's a postdoctoral fellow, and Andrea Jesselhaus, who's a research coordinator. This project is funded by the BC Support Unit and in-kind support by Trinity Western University. You can also use these Twitter handles as well as my Twitter handle, Angela_Wolf. Or my email is included here if you wish to contact me about this presentation. I wish to do a land acknowledgement for Trinity Western Universities located on the traditional ancestral unceded territory of the Stolo people. This presentation is about a research project that is in progress, near ending, around creating a resource guide to support clinicians who will be using PROM data to support their practice at the point of care. The research question is looking at how healthcare providers interpret and integrate data from patient-centered measurement assessments into routine clinical care. Practice exemplars were used from oncology, mental health, rehabilitation, and maternal child health. This project was supported and shaped by the theoretical foundations of the Consolidated Framework for Implementation Research, which one of the 5 domains focuses on the characteristics of individuals, to then uncover some of the underlying needs and factors influencing healthcare providers. Layered on top of that was the theoretical domains framework, which further illustrates the 14 domains, which represent 33 change theories and 128 theoretical constructs that focus on the determinants of behavior, in this case, clinicians adopting patient-centered measurement. As an aside, if you'd like to learn more about these theories, you can attend the Clinical Practice Special Interest Group Educational Symposium entitled Putting the Horse Before the Cart, Understanding the Needs and Factors that Influence Clinicians' Behaviors to Integrate PROMs into Daily Practice. I'm going to be talking about 3 phases of our study in which we triangulate different methods and data sources to develop a comprehensive understanding of this topic. The mixed method systematic review, which I'll briefly touched on, the protocol was published in June of 2021 in Systematic Reviews. I'll also talk about the qualitative description study, which informed the one-on-one interviews of 20 healthcare providers and 2 focus groups of physiotherapy students, and following by a deliberative dialogue that was held 2 weeks ago on that included 50 stakeholders and including patient partners in that. The characteristics of the individuals, these are the main 14 domains that then look at the deterministic factors that may influence clinicians' behavior in adopting patient-reported outcome measures. They can be grouped into 3 overarching themes of capability, motivation, and opportunities. I'm going to use this framework to shape the rest of the presentation, so all the capabilities will remain in blue, the motivations in black font, and the opportunities in purple. In doing the systematic review of 127 articles which have been synthesized to date, the 7 main factors that were important were 3 about the skill, about capability, 3 about motivations, which are outlined in black, and 1 about the opportunities that serve as enablers. When we moved on to the qualitative interviews, you can see here that we had a sample of a variety of different healthcare providers, including not only physicians, but also physiotherapists, registered nurses, registered clinical counselors. You'll see the breakdown was fairly even amongst the 4 different clinical exemplar areas, with at least 65% of those involved in clinical roles, and at least 60% of people had used PROMs more than 5 years, and 90% greater than 3 years and onwards. When we looked at the data here, we also see that we have 3 main capabilities: knowledge, skills, and decision-making process. We have 3 main motivations. And finally, we see the environmental context and resources were also identified as one of the enablers. These 7 main themes or domains were about the needs and influential factors. Although they varied in order, they represented the same constructs that were identified in the systematic review as being important. Based on the data from phase 1 and 2, we then created an evidence brief. This evidence brief was summarized all the research findings to date with the intent to provide a 5-page document that would be shared at the deliberative dialogue. So in that document, we actually included, in addition to the 7 domains that had been identified in the previous 2 phases of the study, we also included some additional items, 5 additional items that were talked about frequently from the systematic review as well as triangulated in our interviews. There was a description of each domain, and provided in there was a summary which then was sent out ahead of time for our deliberative dialogue. Also in the evidence brief, there was an appendix that outlined the study design and gave information about the 127 articles that were used, as well as the demographics from the interview. So what do we do with this evidence brief? In the deliberative dialogue, I'll just explain a little bit about what that is. A deliberative dialogue is the purpose of it is to have a facilitated discussion with key stakeholders to offer a variety of perspectives with the aim to have consensus building and the co-creation of evidence that can be used then, in this case, to facilitate the development of the resource guide. The key components then was this evidence synthesis, which I showed you in the brief. We did a stakeholder analysis that involved members of our research team identifying clinicians, patient partners, researchers, and other leaders that might be able to inform us of the importance of these factors with PROMs implementation from the clinician perspective. We also had then the 42 participants that were involved overall with representing 5 different small groups that were used. These small groups had activities that were done as part of the deliberative dialogue with a facilitator and note taker for each of the groups. As well, there were 2 lead facilitators. The activities then were facilitated activities and small group discussions that were held to identify and go through clinician experiences in implementing PROMs, some of the factors that were most important to address their needs, and then to identify actions and strategies to help support clinicians. This forums are deliberative dialogues are traditionally completed in person. This one, again, due to COVID, was completed virtually. The deliberative dialogue then with the virtual allowed us to use breakout rooms as well as a polling function. In this instance, we use Menti, and help to facilitate and create various activities for discussion. Preparation is really the key, but in virtual dialogue, we also had to have many various individuals involved as well. We wanted to, doing this virtually allowed for that to have 2 half days of deliberative dialogue, which allowed for geographically distanced individuals to attend, and also proved to be an economical and inclusive way of engaging stakeholders. In the deliberative dialogue, one of the questions that we asked was which factors are most important to change clinicians' behaviors in adopting patient-reported outcome measures into daily practice. So our stakeholders identified, again, similar, the top 6 items that were identified or factors were actually those that were identified in the others as well. with the exception of the social professional role as being a little bit farther down. And part of the reason was the focus on some of these basic things, such as practical knowledge, procedural knowledge, skill development, as well as really looking at the clinician and how they interact with the environmental context. So again, we see as far as triangulation is concerned, we were able to highlight some of the key factors that really influence the implementation of individual level PROMs data across practice settings. So as I identified initially, we used multiple methods and data sources to help develop a comprehensive understanding of what are the characteristics that are most important to clinicians that will influence the implementation of PROMs and help to change practice behaviors. In these, we see that knowledge, skills, and decision-making are some of the key capabilities. Knowledge was both general, theoretical, and specific knowledge about PROMs, as well as then understanding that knowledge and how that could be translated to the interpretation of PROMs and facilitating clinical reasoning processes in leading to informing shared decision-making with patients. Clinicians also needed to identify and develop competence to be able to discuss the PROMs, not only in introducing them, but also in being able to, with confidence, just articulate what the findings or what the results of the data actually were as well. Regular ongoing practice and evaluation feedback was important to incorporating them. As well, we noted various beliefs and attitudes about their capabilities, and something fairly new to the literature was the social and professional roles and identity, as well as looking at some of the environmental context. To conclude, one of the main things was developing, forthcoming in January 2021, is a guide on implementing patient-reported outcomes, but more specifically looking at the clinician's needs and factors. So in conclusion, I do want to also acknowledge my team of 28 members that we used an integrated knowledge translation framework to be able to complete this work. Thank you very much for your time.